and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, with season change, many suffer various kinds of diseases. And when we talk about children, then we have to take extra care about their immunity system as well. So viewers, today we have in our studio Dr. Mridu Plaban Borah, child specialist from Excel Care Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for coming to Good Life, the health show. So as the season is changing, slight winter is also approaching. So we have to see that children are most maybe when season changes, they also go prone to some kind of diseases. And talking about the immunity as well, lots kind of immunity system has to be taken care of, and at this present juncture also. So at first juncture, what would you like to start with?
Yeah, I'm very much happy to coming to this show actually. So if you just say about this diseases with the children at the change of weather or season, whatever you like to say. But the most common thing, whatever we find in day-to-day life for the children is that, so most of the children, fever is the most common symptom for any kind of illness. If you say fever is the most common symptom. So whenever there is fever, actually we can just enumerate lot of causes. Fever may be because of cough and cold. Fever may be because of normal diarrhea. Fever may be because of some gastroenteritis diseases. Fever may be because of some ear infections, nasal infections, eye infection, dental infection, throat infection, chest infection, all kind of stuff. Fever is the most prominent symptoms.
Any kind of problem which is being faced in the body.
Okay. The fever may be the one of the most common symptoms that the parents may come
across, yes.
So the other diseases with the change of the weather is like that. We can see cough and cold. Okay, diarrheas throughout the years. Actually, we can see diarrheas. So if you say that what are the common diseases with the season is the basically fever, cough and cold, diarrheas, and this is the most common things actually. But in the last few days actually, what I can assume that a lot of measles cases we are coming across
at this season. Okay.
So a lot of cases in the last 2 weeks actually I can see that there are a lot of measles cases. Measles also usually the first presentation is fever. After 4 days or 5 days, we can see the rashes all over the body. But the measles in this age, in this period, actually, measles. A lot of patients I'm coming across, which are coming resulted as measles. So regarding immune system, it's not like that with the change of seasons, immunity it changes and
it fluctuates.
Or the fever appears or some diseases. It's not like that actually. For children, actually, what I would like to say that with every change of seasons, or if you just forget about the seasons actually, the children can suffer any kind of viral illnesses at least 4 to 5 times a year.
Okay.
It's okay. As I have just mentioned that fever may be the predominant symptoms of any kind of viral illnesses or any kind of diseases.
Which gives you an indication that something is wrong in the body.
Yeah, okay. So most of the parents actually, so in the 12 months time frame, when a child suffer at least 4 to 5 times of fever during a period of year, actually the parents become very much conscious.
All right, doctor, we'll talk on that. We have a caller waiting, so let's take the call and then we'll proceed with the conversation. Hello.
Hello. মই সাৰক কথা এটা শুনিব বিচাৰিছিলো।
হয়,
কব।
মানে এতিয়া ধৰক বতৰটো চেঞ্জ হৈ আছে, মানে মোৰ এটা 6 বছৰীয়া ল'ৰা আছে, সি মাজে মাজে ধৰক মানে আইসক্ৰীম হয়, ঠাণ্ডা পানী খাব বিচাৰে। এতিয়া মানে তাৰ চৰ্দিৰো অলপ অসুবিধা আছে আৰু চৰ্দি লাগে। এতিয়া ছাৰৰ পৰা এটা কিবা পৰামৰ্শ বিচাৰিছিলো আৰু খোৱাব পাৰিম নে নোৱাৰিম, মানে বহুত জিদ কৰে কেতিয়াবা।
হয়, সৰু ল'ৰা ছোৱালী হিচাপে আইসক্ৰীম খোৱাৰ কাৰণে জিদ কৰাটো একো মানে মই ভাবো যে কি এটা বৰ বেয়া কথা নহয়, ভেৰি কমন। তো সেই বুলি আপুনি ৰেগুলাৰ বেচিছত যদি দিয়ে সি হয়তো শৰীৰৰ কাৰণে অপকাৰ কৰিব পাৰে। 2 নম্বৰ কথা যে যেটো তেওঁ ঠাণ্ডা পানী খাব বিচাৰে বা এনেকুৱা কৈছে, একচুয়ালি বহুত মাক বাপেকে কুহুমীয়া পানী খাব বিচাৰে। মই যেটো দেখা পাওঁ যে কিন্তু কুহুমীয়া পানীৰ যেটো আমি টেষ্ট আৰু নৰ্মেল পানীৰ যেটো টেষ্ট সেই দুইটাৰ ডিফাৰেন্স অলপ বেলেগ হেতু হিচাপত মই এটো ক'ব নিবিচাৰো যে আপুনি ঠাণ্ডা পানী খুৱাব ফ্ৰিজৰ পানী খুৱাবলৈ মই কেতিয়াও সাজেষ্ট নকৰো আৰু যদি সঘনাই সৰ্দি বা কাহ হৈ থাকে আৰু আপুনি যদি ভাবিছে যে আইসক্রিম খালেহে হয় বা ঠাণ্ডা পানী খালেহে যদি হয় তেনেহলে তাৰ হয়তো কোল্ড ইনডিউসড কিবা এটা প্ৰবলেম হোৱাৰ সম্ভাৱনা থাকে গতিকে মই ভাবো যে আপুনি নৰ্মেল পানী দিয়ক আৰু কেতিয়াবা সময় সুবিধা বুজি এটা আইসক্রিম খোৱাত মই কোনো আপত্তি থাকে বুলি নাভাবো
ঠিক আছে দিয়ক স্যার ধন্যবাদ
ধন্যবাদ
All right, thank you so much for calling. I'm sure at least some idea you must have got what just doctor had prescribed you. So this is actually very commonly seen in every parents and every children. They want ice creams or it may be in any kind of season. But that's all not. But parents have to take an extra care about them. So at this time, what would you like to put the suggestions on them, doctor?
If you just particularly mention this season actually or this critical crisis period actually we got lot of actually phone calls from the parents that doctor how to boost up the immunity of our child because there is corona is going on the season is changing something going on here and there actually we just afraid to go to the hospital please give something over the phone it's not like that actually
okay doctor we have a caller again so let's take the call first hello
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
আচ্ছা মই লৰাটো এই সাৰটাতে অপাৰেশন কৰিছিল 2018 তে
হয়
এক্সেল কেয়াৰত
হয়
এক্সেল কেয়াৰত
শুনি আছে আপুনি কৈ থাকক হেল্ল'
পাকস্থলীৰ লগত মানে খাদ্যনলীৰ লগত পাকস্থলীৰ সম্পৰ্ক নাছিল নলবাৰীৰ পৰা কৈছো মই
হয় কওকচোন বাৰু হয় শুনিছো মই
মনত পৰিছে নে
বেবিটোৰ নামটো ক'লে মোৰ মনত পৰিব তথাপিও আপোনাৰ সমস্যাটো কওক
আচ্ছা খাদ্যনলীৰ পাকস্থলীৰ সম্পৰ্ক নাছিল তাৰ ৰেয়াৰ অপাৰেশ্যন হ'ল 3 দিন পিছত এতিয়া বেবিটোৰ স্যাৰ কথা নলয় স্যাৰ
কথা ক'ব নোৱাৰে
হেল্ল' স্যাৰ তাৰ নামটো আতিয়ান তাৰ মানে হেৰি তাৰ জন্মৰ এদিনতে এডমিট কৰোৱা হৈছিল
না হেতু কথা মই বুজি পাইছো এতিয়াৰ সমস্যাটো ক'ব পাৰিলে ভাল পাম
এতিয়া স্যাৰ পিছটা মাতটো ওলোৱা নাই আৱাজটো নাই এনে ঠিকই আছে বাকিখিনি কিন্তু আৱাজটো পোৱা নাই তাৰ মাতটো অহা নাই
হয় এতিয়া কথাটো হৈছে আপোনাৰ যেটো সমস্যা তাৰ যেটো আমি খাদ্যনলীৰ আৰু পাকস্থলীৰ যেটো আমি অপাৰেশ্যন কৰাইছিলো হেতুৰ লগত এতিয়াৰ মাত কথাৰ লগত হয়তো কোনো সম্পৰ্কই নাই কিয়া তাৰ এতিয়া বুধহয় 2 বছৰ আহে
বহুত দুৰ্বল অৱস্থাহিব পৰা নাই যে
হয় এবাৰ চাব পাৰিলে ভাল আছিল 2 বছৰ আগতে চোৱা এতিয়া হয়তো মোৰ ইমানখিনি মনতো নাই কিয়া
ক'ত পাম এতিয়া
মই মোক এক্সেল কেয়াৰ হস্পিটেলতেই পাব যেতিয়া আহে
হয়
যোগাযোগ কৰি আপুনি আহিলে মই ভাল পাম তেতিয়া আমি এটা সবিশেষ
আৰু তাৰ এটা সমস্যা আছে সমস্যাটো হ'ল কি সি খালে যদি ভালকে জুগটো পায় বস্তুটো তাৰ সেই জইণ্টটোত অলপ মানে বজি যায়
কোনখিনি জইণ্টৰ কথা ক'লে
তাৰ যিটো জইন হৈছিল পাকস্থলী আৰু খাদ্যনলীৰ লিংক যিটো আছিল সেই লিংকৰ মানে সেইটো বজি যায় খাদ্যটো বজি যায় সি আকৌ খাব নোৱাৰা হয় তাৰপিছত পুনৰ উলিয়াই দিয়ে যদি পাৰে উলিয়াব চেষ্টা কৰে তাৰপিছত উলিয়াই বহুত সময় পাছত
হয় মই আপোনাক এটা কথা জনাব বিচাৰিছো যে যেটো অপাৰেশ্যন হৈ গৈছিলে যি ধৰণৰ অপাৰেশ্যনৰ কথা আপুনি ক'লে হি এটা খুব এটা মেজৰ অপাৰেশ্যন যদি আপুনি 2 বছৰ ধৰি প্লাই চেকআপটো আহা নাই কিয়া তেনেহলে মই ভাবো যে আপুনি খুব এটা ভাল কাম কৰা নাই আপুনি খুব সোনকালে আহি বেবিটোৰ চেকআপ কৰাটো খুবেই উচিত হ'ব তাৰ মাতকথাৰ ডেভেলপমেন্টৰ কাৰণেও চিন্তা কৰাটো এতিয়া খুব উপযুক্ত সময় আহি পৰিছে কাৰণ 2 বছৰ হৈ গৈছে এইখিনি সময়তে যদি আপুনি সেইখিনি কেয়াৰ নলয় পিছলৈ কিন্তু আপুনি সমস্যাত পৰাৰ সম্ভাৱনা থাকিব আৰু যেটো অপাৰেশ্যনৰ কথা ক'লে সেইখিনি আপুনি আহিলেহে আমি এবাৰ চালেহে তাৰ সবিশেষ আমি কথাখিনি গম পাম
Absolutely. So thank you so much for calling and I'm sure the problem which you have mentioned and already this is a case which you have handled earlier and it's better that the person should come and show their child and it's better to see it and then only you can say anything clear about it, isn't it? Alright, doctor, let's come back across the seasonal changes, diseases and let's talk about the prevention measure, how parents can take care about their children. So what are the things you would like to mention?
Okay, what I have mentioned in my previous, so the thing is that fever may be the predominant symptoms and most of the parents, they want that their child should be strong. Okay, we should give something that the child does not suffer from any kind of illnesses. But never happens. The thing is that the seasonal fever is very important for the development of the immunity of a child.
Okay.
So actually the thing is that once a child born, actually they do not have any kind of immunity in their body. So they get immunity from breast milk, number one, and after that actually they get immunity after giving injections or vaccines
all
for
kind
a
of
immunizations. And the other thing is that once they get infected with the common viral diseases, their immunity gradually builds up. Okay. It's not like that somebody has born and they have got all kind of immunities and he will not suffer from
any. But it gets generated every day by day with all kinds of things which has been necessary.
Okay. That's why actually we just suggest exclusive breastfeeding up to 6 months of age, because for the first 6 months of age actually the breastfeeding will protect the baby from all kind of illnesses.
Okay. Doctor, we have another caller waiting, so let's take the call. Hello.
Hello.
Ami khuni asu prashno to koribo apunar.
Hi. Mor soalijoni boyak 12 বছৰ হৈছে এই এটা মানে লেংথটো ঠিকই আছে তাই ক্ষীণ আৰু খেংখেঙিয়া আৰু তাই তাৰমানে পেণ্টিবিলাকত অকণ বগা চাপ যোৱাৰ নিচিনা কিবা অকমান লাগে এটোৰ কাৰণে কিবা ট্ৰিটমেন্ট কৰিব লাগে নেকি স্যাৰ মই
হয় ডেফিনেটলি ট্ৰিটমেন্ট কৰিব লাগিব আৰু যদি ছোৱালীজনী বয়স হিচাপে যদি ওজনটো বাঢ়া নাই তেনেহলে ছোৱালীজনীৰ কিবা ডেফিচিয়েন্সি আছে নেকি আমি প্ৰথম কথা চাব লাগিব এক নম্বৰ দুই নম্বৰ কথা হৈছে কি তাইৰ যেটো বগাছাপ যোৱাৰ প্ৰবলেমৰ কথা কৈছে হেখিনিও আমি কিছুমান ডিসকাশন কৰি চাব লাগিব বা কিবা ইনফেকশন থাকিব পাৰে তো হেখিনি আমি আমাৰ মাজত হোৱা আলোচনাৰ পিছতহে আমি কথাখিনি ক'ব পাৰিম এটো ডাইৰেক্ট আপুনি প্ৰশ্নটো সুধাৰ লগে লগে মই ইয়াৰ চিকিৎসা দিবলৈ মানে অপ্ৰস্তুত তেতিয়া
Okay, thank you so much for calling. It's better that the person should come and see you, and then the problem will be diagnosed and then treatment can be started at the earliest. All right, now talking about the immunity which you said that the first 6 months is very important for the child to get the breastfeeding because that saves you from all kind of diseases.
So for the first 6 months, breastfeeding is the first thing we have to provide to the baby, and it will build up the immunity. Second best thing is that immunizations, because within the 6 months time frame, actually we give lot of vaccines. It will help the baby from that any kind of infection from later life. Okay, it's not like that we have given the injections today and child will not develop that kind of disease from tomorrow onwards. It's not like that. Secondly, there are much more important vaccines. Actually, number one is typhoid vaccine is there. Hepatitis A. Because in our developing countries, actually, our water is not at all perfect. Okay, we should prevent the child from being infected with hepatitis A because it is a waterborne disease. Second, typhoid. Typhoid is a waterborne disease. By immunizing with hepatitis A and typhoid, probably we can save the baby from getting infected with hepatitis A and typhoid. So, what is my viewpoint is that we should vaccinate whatever the available vaccine is there for a child. So next vaccine what we can do is that exposure, number one. It's not like that we'll just keep the baby in a closed environment, in a room, and child will not be suffer from any kind of, it's not like that. We should expose the baby. He should develop properly. And third best thing is the food. Everybody asks that, sir, give me something, some health drink so that our child grows very nicely and he become very much immune to the diseases. It's not like that. If we just talk about the food, actually, what we give in the food, we give protein. We give carbohydrate, we give fats, we give vitamins and minerals. Okay. If we can provide a child with a balanced diet, probably we can get all the things that our body requires.
All right, we'll come to that diet part, doctor. We have another caller waiting for us, so let's take the call. Hello.
Hello, মই আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো মোৰ দুটা কোৱেশ্চনছ আছিল মই একচুয়ালি ওয়াকিং মাদাৰ হয় মোৰ বেবিটোৰ বয়স 6 মাহ হ'ল যোৱা মাহত 6 মান্থলৈকে মই এক্সক্লুডিং ব্ৰেষ্টফিডিং কৰিছো এতিয়া তাক মই ব্ৰেষ্টফিডিংটো ইমান কৰাব পৰা নাই মানে মই ডিউটি কৰো আৰু সেকেন্ডলি এই করোনা ভাইৰাছৰ কাৰণে আমি কোনো ধৰণৰ মানে ভ্যাকচিন দিয়াৰ যিবিলাক প্ৰসেস মানে টাইমলি দিয়াৰ সেইটো মোৰ অকমান লেট হৈছে 1 মান্থ 2 মান্থ এনেকে এটোৰ কাৰণে কিবা মানে প্ৰবলেম আহিব পাৰে নেকি এই দুটা চিন্তা আছে
এতিয়া মই আগতে কোনবাটা অনুষ্ঠানত মই উল্লেখ কৰিছো যে করোনা ভাইৰাছৰ কাৰণে বহু মাক বাপেক তেওঁলোকৰ যিবিলাক ৰুটিন চেকআপ বেবিৰ তেওঁলোক আহিব পৰা নাই আৰু দুই নম্বৰ ভ্যাকচিন খিনিৰ অকমান ডিলে হৈছে
ওকে
ই এটা ডাঙৰ সমস্যাৰ কিন্তু সন্মুখীন হ'ব পাৰে আমাৰ মানে মই আপোনাৰ টেকেটৰ বেবিৰ কথা কোৱা নাই আপোনাৰ বেবিৰ কথা কোৱা নাই মই সকলোৰে কাৰণে কৈছো WHO তেওঁলোকৰ এটা সমীক্ষাত প্ৰকাশ পাইছিল যে এই কৰোনা মহামাৰীৰ প্ৰাদুৰ্ভাৱৰ কাৰণে আমি যিখিনি ৰুটিন ভ্যাকচিনেশন আমাৰ কাৰণে পিছ পৰি গৈছে তেওঁলোকে এটা কথা অনুমান কৰিছে যে হয়তো আজিৰ পৰা 2-3 বছৰৰ পিছত যিবিলাক ভ্যাকচিনৰ পৰা আমি কিছুমান দুৰাৰোগ্য বেমাৰৰ পৰা প্ৰতিৰোধ কৰিবৰ কাৰণে শিশুবিলাকক দিয়া হয় সেই দুৰাৰোগ্য বেমাৰবিলাকৰ হয়তো প্ৰাদুৰ্ভাৱ আকৌ নতুনকৈ হ'ব পাৰে ধৰি লওক ডিপথেৰিয়া টিটেনাছ পাৰ্টুছিছ এইবিলাকৰ হয়তো নতুনকৈ প্ৰাদুৰ্ভাৱ হ'ব পাৰে কিন্তু সেই কাৰণে এটা কথা মন কৰিবলগীয়া যে কৰোনাৰ কাৰণে আমি ভ্যাকচিনেশনটো ডিলে কৰা উচিত নহয় টাইম টু টাইম আমি ভ্যাকচিনেশন দিব পাৰিলে আমি সঠিক সময়ত সেই বেবিটোক আমি ইমিউনাইজ কৰিলে
So it's very important to take all the vaccinations on a proper time. But it depends on the situation because the situation has been created so that parents get fear that how will they take out their children and go to a hospital because there is some kind of fear psychosis among everybody. So, but proper vaccination should be taken on proper time.
If you just think about the corona and all this thing actually it's not like that corona is coming to you and corona will kill you it's not like that actually we have to live with corona okay we have to protect us from all kinds of things actually and we should maintain our proper hygiene and all so thereby probably we'll be safe.
All right, Doctor, we'll have to slip into a short break and again we'll come back and do all the discussions that's needed. All right, viewers, we'll slip into a short break but do come back soon because we have lots more on the other side. Welcome back, viewers. You're watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion. So we'll come back again. Doctor, earlier to the break, we were talking about the dietary part of children and what kind of food should be given properly to the children so that their immunity gets intact and it's also generated.
What I have suggested that actually we should give proper balanced diet. The balanced diet means there should be protein in the proper amount, carbohydrate in the proper amount, and fats in the proper amount.
Okay.
So apart from that, actually we have to make the habit of taking a lot of fruits and vegetables because fruits and vegetables will give you the required amount of vitamins and minerals. Most of the parents actually they asked us actually the doctor please give some vitamins to boost up the immunity. It's not like that. From food actually if you give properly actually we can gather all kind of minerals and
That's
vitamins.
the natural vitamin you'll get.
So what is more important regarding this season actually the thing is that we should give the child iron. Iron improves the level of iron and it will boost up the immunity. Iron also helps in development of the hemoglobin level. So if a child is properly ironized, actually if the hemoglobin level is good, iron level is good in the body, his memory becomes very nice. Okay, his attention span becomes very nice.
Okay.
He can concentrate in a work very nicely. So iron is a very important part. So second part is the zinc. Zinc improves the immunity because in thousands of enzymes in our body actually zinc is a very predominant part.
Okay.
If you maintain the zinc properly, probably our body can function nicely and our immunity improves nicely. So apart from them, vitamin A, which improves the layer in our bodies actually, the mucosal layers in our body actually. The vitamin A improves the immunity in the cellular, in the epithelial part. Vitamin E, vitamin C and vitamin D. These all things actually helps us to build up the immunity. So vitamin D, where we can get the vitamin D? In the sunlight. So we should expose the soil properly. So vitamin C, normally in our food, in the lemons and orange actually we can get vitamin C. So zinc in the all fruits and also in the whatever grows from the soil actually. So the sufficient amount of zinc is there in the that fruits or
proper vegetables are also very important.
Very much important. So that is what actually I want like to say regarding the food. So other things, few children actually they are genetically or because of some chronic illnesses their immunity system goes down.
Okay.
So we should be very careful regarding those children actually.
So how a person will recognize that my child is low in immunity?
Very nice questions. Very nice questions. Some children actually, their innate, their immune system actually, they are very much weak from the birth.
Okay.
Those childs actually, it's not like that the normal seasonal fever will occur to them. They can suffer from severe infections many times in a year.
Okay.
Then probably we can suspect that this child is suffering from some immune deficiencies diseases. So there are a lot of immune deficiencies diseases. So what I would like to mention here is that anybody can suffer from cancer. Anybody can suffer from kidney related diseases.
Okay.
Anybody can suffer from hormone related diseases. Okay, those actually children can have a very deficient immune system.
Or doctor, you mentioned about
system.
kidney. So
Yeah.
how to take care about that chronic diseases like kidney problems in children? So
Because
this
you
is
see,
also very much seen.
During this crisis period, actually, a lot of people actually, not for the children, even for the adult, they are not coming to follow up in a proper time. Because this is obvious. So the situation was like that actually, they cannot come to our routine follow up normally in time. Actually, we are helping them through WhatsApp or through video callings and all actually. The thing is that they should continue their medication properly.
Okay.
And many of the disease actually, what I advise or what the doctors advise is that you just maintain a diary properly of the symptoms of the disease, particular disease. If they maintain the symptoms of the diary properly and if they consult with the doctor with that diary actually, probably it becomes very much easy for the doctor to find out what is the problem going on.
Right. It's very important, like not only the doctor, but also the patient or the person will have to take every necessary precautions because then only side by side things will work positively.
In children, actually, there is a disease called nephrotic syndrome, which involves the kidney.
Okay.
They are kept in some medications where the chances of immunity can go down. Okay, those are very prone to infections. Okay, so it's not like that we'll stop those medication, but they have to be in proper follow-up and proper contact with the doctor so that we can help on time. And the other things is that some children or some adult people also, their kidney is not functioning properly. They have to go to the dialysis. It's not like that because of corona and this crisis period, we'll stop doing dialysis.
We have to continue
go to the continuity.
Absolutely.
Okay, if we do not dialysis, then kidney will further deteriorate and there will be much more problem can create to the body. So it's like that we have to maintain the proper routine, proper follow-up, proper medications, and we have to contact with the doctor in a proper way so that they
time
can
as well. Although, doctor, we are really short of time. So on your last note, what would you like to give proper suggestions to our viewers? And like if we talk about the causes a child to have a low immune system would be, in short, what would you like to tell them?
So thing is that parents should not worry about anything that occurred to the baby or the children, because we are always there to help you out. Okay, just keep a good contact with the doctors, okay, so that he can help you on time. Okay, just give proper diet, vaccinate whatever is necessary for them, okay, and do normal physical activities or yoga so that their immune system boost up. Okay, and the other thing is that for the parents who have got chronic illnesses, parents with children of parents with chronic diseases, they have to come to a proper follow-up so that their medication should be given properly and they should get better care for the all time to come.
Absolutely, doctor. Thank you so much for these wonderful words. I'm sure the viewers who have watched our show must be benefited. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.